More than 250,000 appointments and operations across England could be impacted this week because of the junior doctors' strike.
Junior doctors across England are right now beginning a 4-day strike.
Junior doctors are just under half the doctors in the country.
The disruption will be widespread. NHS bosses have said that over the next 4 days, the health service could be on a knife edge.
Well, let's just sit on a shelf that the government didn't even bother to put up a minister to answer questions this morning, and the health secretary is nowhere to be seen. What no one seems to be pointing out is the government wants junior doctors limited to a derisory 2%, with inflation running in excess of 10%. Just think about that. After all the sacrifices our junior doctors made to keep us safe during the pandemic, that's all this piece of crap government thinks they're worth. Just 2%. Well, absolute bollocks to that. And it gets worse. An analysis by the Financial Times of official data illustrates the real terms pay cuts many workers have suffered in recent years as a result of the austerity policies of the Conservative government. Medical practitioners, which include the junior doctors now taking strike action, have seen some of the worst declines in pay over the past decade. Junior doctors have suffered a massive 26% real terms pay cut since 2008. Almost half of them are now struggling to pay their rent and mortgages. And remember this, after several years of studying, they've already amassed debts of about £100,000. And if all that's not bad enough, if a junior doctor won't submit to whatever the government offers, then the Prime Minister plans to rob them of their democratic right to withdraw their labour by bringing in anti-strike legislation to force them to work against their will and allow them to be sacked if they refuse. Absolute bollocks to this. Meanwhile, the government is engaged in a campaign of misinformation.
They have a multi-year pay settlement, which is 8.4%, which the BMA agreed to and was agreed on
Before the pandemic?
Before the pandemic, but 8.4% is a significant pay increase. They have a multi-year settlement, which was at 8.4%. They have a multi-year settlement, which was 8.4%, 8.4%, 8.4%. 8.4% is a significant pay increase.
It's not rocket science. The 8% figure the Health Minister is talking about is actually just 2% a year over 4 years. And it was agreed at a time when inflation was less than 2%. It's now running in excess of 10%. So for this year, the government wants junior doctors limited to a crappy 2%, with inflation running in excess of 10%. And whilst the Prime Minister's been telling the public this,
when it comes to the issue of pay, we have accepted in full the independent recommendations of the pay review bodies.
When it comes to junior doctors, the government has in fact completely ignored the pay review body's recommendations. Whilst the Health Secretary wants junior doctors limited to a crappy pay award of just 2% on a multi-year pay deal, the pay review body has recommended the government consider a higher level of pay and has actually warned that taking no action would have a significant effect on motivation, affecting retention, productivity and ultimately patient care. Yet the government has completely ignored its recommendations. So next time you hear the government say this,
when it comes to the issue of pay, we have accepted in full the independent recommendations of the pay review bodies.
We accepted in full the recommendations of what is an independent process, the pay review body process.
The government has entirely accepted the independent pay review body's recommendations.
Remember, when it comes to junior doctors, that's just complete bollocks. Our junior doctors have always been there for us. Now let's do what we know is right. Let's be there for them by standing shoulder to shoulder with them in this fight.